we are in Singapore, and the dental office of Dr. Weng Cheu Yue.
Yes.
Weng Cheu Yue.
Yes.
And his wife, Louisa Yue. And these are huge movers and shakers in not only Singapore, but Southeast Asian. I saw you lecturing in Medan, Indonesia. Did I say it right? Medan or Medan?
Medan.
Medan, Indonesia. You are quite the high-tech legend. You're big into Invisalign. You're big into lasers. You're big into CEREC. You studied in Las Vegas with Dr. Chen with neuromuscular dentistry. Dr. Clayton Chan in Las Vegas with neuromuscular dentistry. So there's so many things you could talk about. I don't even know where to begin with you. So tell us your story. Where did you go to dental school? Was it in Singapore?
Yep. I'm a homebred dentist. Yep. 1999, 2000, graduated from NUS, National University of Singapore. And then we have a 4-year bond with the government. So that's the time where we have to serve out 4 years.
Because they paid for your dental school?
Subsidized. So in a sense that, we don't pay a full school fees. So 75% supposed to be paid by the government.
Okay.
So that is our way to return back to the country in that sense, right? So during that time, I have a chance to also continue to learn, not only just working with my basic dentistry. I want to know more what's in store for us. So I have a good mentor, right? Dr. Lim, Dr. Jerry Lim, Dr. Ronnie Yap, and when they're doing surgeries, right, I would actually take a bus from my clinic, which is maybe about 10 minutes away, to the practice. Yep, and I get to see how they do some more advanced surgery, right? And that was during my lunchtime. They will arrange it quite nicely for me, thankfully. And then I'll go back to work after that, right? And with the different posting in the government service, we also get to try out working in military service, then the school service, public health service. So that really gives us a lot of area to experience what dentistry, on a ground level is all about. And then I went ahead and learned about first thing first is advanced posterior composite. All right, that was the first time it got me
with Ron Jackson.
It was Ron Jackson, yes. All right, and that started me thinking about more minimally invasive dentistry. For example, inlay, onlays, which is not so much of an emphasis in school last time. All right, but I just think it's right that we shouldn't cut down as much teeth as possible to make a crown. We should just conserve, and of course now the keyword is biomimetics, right? So we can actually do that. All right. So
explain biomimetics in case someone not familiar with it.
All right. To me, it's that it's like biology. We want to use whatever way that we understand about the biology of dentistry, and we want to mimic the real situation in life. All right. So by understanding how the structure work, right, instead of over engineering things like putting things that's too hard, we should work with the difference in structure of the tooth, and allowing the flexibility, at the same time the rigidity of the tooth to show through. All right. In that way, we can bond to a tooth. Get it to work. All right. At the same time, we preserve our material, and at the same time preserve the natural material of the tooth. To me, that is biomimetics. Right. And understanding bonding well, understanding the type of material well, will help us to achieve the results. And one of the teacher that is really good at it is Pascal Manet. And
Pascal Manet?
Yes.
From Brazil?
No, he's from Zurich. And
he's from Zurich, Switzerland?
Yes, and he's now part of the faculty of USC,
University of Southern Cal in Los Angeles?
Yes. And he is traveling the world to give lecture. And one of his lecture was in Sydney. All right, he always has sold out lecture in San Francisco, right? And then he came to Sydney, and I attended his 4-day workshop, and that again set forth another change in my dental career and my wife's dental career as well. Louisa, my wife, right? We started a new venture called Dental ED, right? Which again provides dental education to the dentists, like what
you started that company. You and Louisa.
Louisa is now heading it. All right. We took on the role of the Asian, or should I say Southeast Asia director, and Louisa is the one heading the whole operation, right? For me, it's because I've been lecturing around the region, so I do get into contact with very good dentists, right? There's been also the movers and shakers of the different areas, and with this Dental ED platform, we're able to provide dental study clubs, right, where we do broadcasts every 6 weeks, right, and dentists gather together. And in Singapore, we run it in such a format that we actually invite a specialist or an expert of the field about the topic that we're going to broadcast.
ED Dental?
Yes, Dental ED Global.
Dental
ED
ED
Global. .com.
Global.
.com. Yep.
And the mimetic dentistry was Dr.
Pascal
Pascal
Magne.
How do you spell Magne?
MAGNE.
MAGNE. And he's from UCLA or USC?
USC. He actually created an undergraduate program for them that is totally concentrating on CEREC dentistry, right, or CAD/CAM dentistry, rather than having them to then learn the traditional way of preparation and manufacturing, and then start to learn or relearn again after they graduate. Yeah, so I think he's very forward-looking in that. And
so Louisa, you're the one that started ED Dental, or you're the one that's heading that up in Southeast Asia.
It started 13 years ago by Emmanuel Recupero in Melbourne. So it's been around for 13 years in Australia, New Zealand, and the US. And
13 years ago by who?
Emmanuel, the CEO of Dental ED Global.
Emmanuel
Recupero.
How do you spell his last name?
RECUPERO.
RECUP.
PERO. PERO. Yeah.
In Sydney, Australia?
In Melbourne. He's based in
Melbourne.
Melbourne. Yeah. So they've got over 100 study clubs in Australia, New Zealand, and they've got a presence in the States too. I'm in charge of bringing it around Southeast Asia, and they've got a manager in China too. So we're growing quite rapidly. Yeah. And we'd always look for opportunities to collaborate. Yeah. With Dental Town, hopefully.
Exactly. So basically now, right, we run the study clubs on a regular basis, and we also run events. So far, we have undertaken a few big projects, like having Galip Gurau. Galip Gurau is in a way like the godfather of veneers, right? So we conducted one hands-on for him so far in Singapore. Mauro Fridiani, prosthodontist, again a teacher of many teachers, right? In prosthodontic work, especially his MIPP, again very minimally invasive kind of prep in prosthodontics, trying to do overlays for restorative, opening up the bite, not cutting down teeth as much as possible, getting good canine guidance, anterior guidance in to preserve the restoration for long. And we also have the Star Italiana group, if you know Angelo.
Out of Italy.
Yes,
Yes.
Angelo Pudiano, a good friend of ours now. And we are even plotting Italian invasion soon. Right, so we are thinking of getting his whole team right down to Asia to have another big event, right? Because Now he has almost 50,000 members in his Facebook group, and it's growing, and a large number of them are from Asia. So I think it's a good time that we can actually do something for the Asian community, with them coming. Then this year we are now hosting one of his group member, Jaudi and Salat. Both of them are very good dentists with composite, and they have published as well, right, with quintessence. And after them, we'll be hosting Pascal Manet in August in Singapore for a 2-day lecture, one on anterior and then posterior composite. No hands-on this time round, right? Because he just did 2 rounds in Australia, all sold out, back to back. Because the first round was all sold out, and then they asked him, and then we managed to get another round going, and then so we have quite a big participation already for that. And we actually got Mauro to run a course in Taiwan with one of our study club dentists, Dr. Andy Low, that we have collaborated with. And also we have one coming up in April in Jakarta for Galip Gurau as well. He's very well received as a dentist in Indonesia. So I think that was just the best place to host him. So we are also having plans in regional training centers, like for example in Cambodia, where again also there's a big growth of in the economics and also in dentistry as well. We have a good friend there, Dr. Tihon Yu, which is also a very interesting and amazing character that as a dentist. He runs his hospital, he has his 2 restaurants, few farms, he has his construction company, he has his trading company that brings all the material to supply him with. And just amazing things that he's doing there. Dr. Low, Andy Low in Taiwan, where he's now teaching DSD. He's coming into Malaysia to run a course. I'll be seeing him in March. I'll be bringing him to Cambodia to start something there as well. And then we're really trying to start a regional alliance. Like now, the last round when I was in Indonesia. Prior to that, in November, I was in Surabaya. So I gave a good 3-hour lecture to a crowd of about 300 dentists on occlusion. And then this time in Medan, I was invited to give a 1-day workshop on laser, right? And then this time round in Jakarta, I was in there for 2 universities program. One for University of Indonesia, we did a CAD/CAM program. And then for University of Trisakti, another top university there, we did laser and hands-on for them because they just acquired a new laser, the water laser. So you're big in lasers, you're big into Invisalign, CAD/CAM, and neuromuscular dentistry. Does it all kind of tie into one? Totally. Explain how all those 4 pieces of the puzzle fit together. Okay, then allow me to start my lecture. Okay, absolutely. Now, are you gonna show your lecture on these slides? I mean, on this big screen? Okay, of course we can go into the details of things, but I'll try to really keep it succinct so that right. So for me, there's this big explosion in usage for lasers. All right, particularly 2 family, the erbiums and the diodes. Right. So when we talk about erbiums, we have 2 main groups: the erbium chromium YSGG, wavelength 2780, like this guy here, water lace I+, and the erbium YAC, right? So that one is 2940, the 2 guys over there, one from Cavo, one from Photona. Right. The erbium lasers are really useful because they work with water. All right. So the chromophore, the specific thing that absorb this wavelength of light, is water. So if we quickly go around and look at this particular graph, right? This is the water absorption graph of, or should I say the relative absorption in water for this kind of wavelengths, right? The erbium lasers are right at the top. So when this kind of light shines to water, water gets really excited, and then it can do its job for us, right? Water is present in soft tissue, in the hard tissue, so we can actually get both of it working. All right, so we do surgical and everything, literally. So for erbium lasers, and they have the YSGG and the erbium YAG laser, so they differentiate by this coefficient on the graph, but it's actually 300% difference. So is erbium YAG laser, the other two guys are better absorbed by water. This is slightly less, all right? But slightly less is actually sometimes a good attribute to a certain extent, because it allows a little bit more energy to be dissipated around that instead of being absorbed by water. So you have a bit of warming effect. That warming effect actually comes through as hemostasis in surgical. All right. So when we use the two to cut, we have more bleeding. When we use the water lace, right, less bleeding because of that differential in absorption in water. All right. So you can see from the graph here also erbium YAG, erbium YSGG, and diode goes right through. Water has nothing, it doesn't absorb, so it's a good thing as well. That's why we can use diode to go into deep tissue. All right. And we all know diode to be good, lasers for soft tissue, and most dentists do use that. But we always face a problem of charring, carbonization of the soft tissue. If you use the erbium laser with water, you tend not to have those problem. And diode, for me, if I use it for soft tissue, it will be too slow and too inefficient compared to the erbiums. But recently, there's a very, very big development in the field of photobiomodulation or biostimulation, or earlier on is known as low-level light therapy, LLT, LLT for short. Now we can use light to influence healing capacity of the person. We can use light to biostimulate, to increase the level of, ATP, nitrous oxide, reactive oxygen species. All this, right, helps the body to actually work better in terms of healing, all right, in pain management. And I will be able to show you a few cases like in there to actually illustrate those facts. So these graphs tell us where the absorptions are. So you can see the erbiums are closer to this range. Higher level work with water, so erbiums are good for that. Diodes, not there, but here nearer to the red color, oxygen hemoglobin. So you can actually use the diode to activate right here where the hemoglobins are, absorb the energy right into it, and then get the mitochondria in the red blood cells to do the wonderful thing of biostimulation for us. And looking at cases, right? So one of the interesting cases that I usually put us through is this. Okay, so there are many applications. One of the applications that I use it for is in implant dentistry. Okay, so I did a certification course with Frankfurt University for my implantology. So part of the graduating criteria is that I have to present a lecture or a poster presentation. So I did this in 2009 regarding how we can use laser in all stages of implantology. So part of it goes into this first row where we use it for osteotomy. So you can do it for soft tissue incision, top row up there, where we cut off. You can see over here, it's like we can elevate the flap and then use the laser to cut the bone. All right. So literally doing osteotomy, osteoplasty, right, and doing osteosurgery to create the implant site. Then we place the implant in there. Or we can also do it this way where we can use it like a very fine instrument to dissect the tissue. So literally I can dissect the periosteum of the mucosa now. All right, now I have a pouch. I can use my biomaterial and put it in my periosteum pouch, suture that, and now I score my mucosa, allowing for more stretching and close the wound with more less tension, should I say? Less tension, good primary closure. Or you can do second stage surgery to open up, well, the gum to expose the implant and put on your healing cap or sulcus former. Or you can contour tissues around your abutments, right, to receive those denture-borne prosthesis, or should I say the implant-borne prosthesis more accurately. And sometimes we get this kind of dislodgement of crowns, right? We can use that to clear away the overgrown tissue easily, and we can do the cementation rather well. But I think I see a big potential in this field where we use that to treat peri-implantitis, because I think many studies have shown that laser actually can do a better job than most other methods. All right. So one of the ways to go about doing it is presented in this case, where I do a multidisciplinary approach. So we have, like I mentioned earlier, we have the endodontics, we have the Invisalign, we have the laser, implantology, and neuromuscular. Part of it is doing the surgery first. Okay, before that, sorry, let me just go back one step again. Right, you can see from here, patient actually has a tooth that requires a root canal treatment, right over here, and it has two pontics just to close up those outward gap, that was created due to the shifting of teeth because of the loss of the molar early on. What we did is that we did a root canal, we did a temporary crown, right, and then later on move on to Invisalign, moving the tooth and closing those gaps, creating a space for us to place the implant, and we did CEREC to actually do a crown, and now we're into this.
Can I have a question?
Yep.
I often see TMD, I've seen neuromuscular. What is GNM?
Yep. The traditional neuromuscular dentistry started almost 47 years ago. The Jankersons started with that, right? So over the years has some evolution, right? Of course, as most subjects, as we find out more about things, right, we add on more information to the basic concept and philosophy to have a better understanding. So in the recent years, Dr. Clayton Chan, right, did more of the research, and he came up with this subset of neuromuscular, or now I would call it even probably the mainstream neuromuscular, in my opinion, neuromuscular with a G. G stands for netology. Okay, it also stems from his background. He started as a technician. All right,
A lab tech.
All right.
In Vegas?
In Germany. Yeah.
Clayton was born in Germany?
No, Clayton was posted together with his father. Right, his father was with the military, and he went to Germany with his father. And he has brothers in medical field, and in also dental field as well. So in his own words, right, he's a little bit of a rebel in the beginning, right? Yeah, but thankfully he met the right person, his wife Jane, I would say. Then that got his starting about family and then the future. And that's when he started doing dentistry with Loma Linda. I think he will be the best person to tell his own story, but in short, he has information about with technical, right? And then he did training with the CR group, centric relation, and then neuromuscular. And then with more understanding of neuromuscular, he has incorporated all this understanding, especially with the netology, which is that fine tuning of the occlusal surfaces, right? To support this whole philosophy that he has it, and then we come up with neuromuscular with a G.
And when you're doing neuromuscular dentistry, Invisalign is a big part of that?
Yes. Again, that is a little twist that I've put in there on my own as well. Like for example, to get to jump around again. Okay, let's go to that point. Okay.
You can finish your case.
No.
I don't want my questions.
We'll just do that. We'll just do that now. Okay. So we can go back to that laser part later, right? This is my favorite part too. All right. So with from this case, the girl came complaining of pain in the left joint, awkward opening closure. Mom always see her moving her face in a funny odd way when she's chewing. All right, she has closed lock for 2 years. Right. So if you look at OPG, nothing too significant. Right, teeth are where they should be. The joint seems to be a little bit more hidden away in the condylar fossa, not so evident in the outline, right? But from this, of course, we can't tell for sure. Joint X-ray, 3D X-rays, all will be helpful. So, but basing on the neuromuscular, dentistry that Clayton has taught me, right? We learn how to recognize every individual's isotonic muscle resting physiological position, where the joints are nice and comfortable in the housing, and when they open and close, right, they are following a certain trajectory, some opening closure path that does not cause too much discomfort. But that we need to re-establish, because when patient comes to us with pain, obviously they are into a pathological position already. Most of the time, I think we can accommodate. That's why we have no pain, no big issues. Only when we fall off the cliff, right, that's when they start trying to see whether there's a solution for it. So using the method mainly to relax trans-electrical neurostimulation. So we work on the 5th nerve and 7th nerve first, right? Relaxing the 5th and 7th nerve, we are now able to tense the muscles, right? And then achieve that nice isotonic contraction. And from there, we are able to measure using our computerized device to see where that pattern lies. All right, where is that usual zone that the patient relax into, and what is the trajectory? Where the opening closure path when they are allowed to be nice and relaxed, unposed, right? Then we determine the position, and we then fabricate devices like this. It looks like a normal splint, but the thing that goes into it is a little bit more. Can imagine that if the bite is right, the patient would not have any issues. Obviously, there's something wrong with it, and we need to alter it. So where is the position that we should open the patient to? Where is the AP? That means anterior posterior position. How about the roll, the turn of the jaw? How about the pitch of the jaw? So there's a 6-axis pitch, yaw, roll, up and down, left and right, front and back. So we can determine that roll. It's just like, the car is having some alignment issue, suspension issue. You're not going to fix it while it's still on the ground, right? We usually have to put it on the jack and then just drag the whole car up. Let the whole wheels and the whole suspension and axle, let it relax, right? Let it hang loose, then we can do our job. Same thing for the joint. We can't fix it while it's still in its usual bite. We relax it and see where it hangs loose, all right? So from there, we determine the position and record it down, send it to our lab. Las Vegas Aesthetics, or Dora Lab in US help us with all this.
What's the lab in Vegas?
Las Vegas Aesthetic, LVE for
Is that
It's on.
Clayton's lab?
No, it's Ray Foster's lab. Ray Foster.
In Las Vegas.
It's Las Vegas.
What's his www?
Yeah. I think it's www Las Vegas Aesthetics. Yeah.
Las Vegas Aesthetics. And that's who makes your splints?
It's made by orthotic. Yeah. It's if you think about it, it's an orthopedic splint. It's orthopedic because we are moving joints and muscles, right, to the position. Dora Lab in Miami is also making it as well. So basically now, right, you have that position, right? Now we make an overdenture, literally. Overdenture, or should I say a clear overdenture with anatomical bite established at the back, so that when the patient bites down, it's just as though you're biting onto teeth, all right? Your cusp tips go into the fossa, and you have very stable relationship between the teeth, right? Upper teeth and lower prosthetic teeth. And anteriorly, we have the guide plane in terms of the canine anterior guidance, right? So that when the jaw goes in laterotrusive and ascursive, there's also proper disclusion of the joint and muscle and the bite at the back, so that you don't over exert forces. So this device, overdenture, is like our trial situation, right? So is theranostic, therapeutic and diagnostic at the same time. Okay, therapeutic, if we get it all right, adjust it to the right position of the patient, we now can level off the jaw, relate it to over a new plane, allowing the upper arch to actually balance off to it, changing the cranial cervical alignment, all right, at the same time the whole postural chain that can actually correct with it. Or else we sometimes also still need our auxiliary colleagues like chiropractors, NUCAs, PTs to help us to actually manage some patients when they're more severe in certain position.
In Poland, a Dr. Marcin Dalecki, he calls it chirodontics. Have you ever heard of that term?
Yes, I do.
Have you?
Yeah, it is actually the truth is, right, even chirodontics, right, is like there's another doctor, chiropractic doctor in US that's very good, is Eric Dalton. Okay, Eric Dalton look at
Where is he at in America?
I can check it out for you again.
Okay.
So basically, he has a whole series of blog online that tells us how to relate the head to the toe and everything else in between. Putting forth, right, the interconnectiveness of things, interrelatedness of things. Not taking one joint out and then we thought that we're just treating the TMD without thinking that, like, look, there's a trick question. Can you move your lower jaw? You can. Can you move your upper jaw? You just did. All right. So basically, yeah, your lower jaw is hinged over here at the TMJ. Your upper jaw is hinged over the occipital, allanto axis joint over here. So literally, we can move those joints, right? It's just a matter of thinking about it. And there's a relationship. Like Roccabado, Javier, they're all talking about it, giving causes on it too. We're talking about action-reaction force. And there are many papers that I can show you later on also, right? That is talking about postural positioning, changing the spinal relationship as well. All right. And also in Japan, they did this very interesting studies. 19 teeth and below compared to 20 teeth and above. If you have 19 teeth and below, your chance of incidental falling, right, and hurting yourself is 2.5 times more because you have less teeth. You have 20 teeth and above, you're better off. If you don't, no worries. If you make a denture and help them out, you reduce the chance of falling to 1.36 times. So literally, you need your head to be properly aligned, supported in order for your whole functional component to work. And why not? Because when we work, when we eat, should I say, our fifth nerve is acting on our muscle of mastication. But you cannot chew without moving your face. Alright, so your facial nerve is at work. And when facial work is work, you don't have to tell your tongue to go left or right. Right? Your tongue knows where to go where you're chewing because it is also in connection with the 5 and 7. And when you're ready to swallow, the vagus nerve is really to help you out and swallow. So the 5, 7, 9, and 10 all work together to feed to the trigeminal nucleus. And at the trigeminal nucleus, right, you literally have this whole gang of 4 working together to feed. You can see 5th nerve, facial nerve, 9th, right, and then your 10 and even your 11, all right, they all go down together to the trigeminal motor nucleus, right, and all are doing the touch position and pain temperature control. Going in there, the spinal trigeminal nucleus will now help you pain temperature sensation, proprioceptiveness. The principal trigeminal nucleus help you with positioning, all right, because of touch and position. And they actually have an analogous one that goes down the spinal cord, will help you map the whole body. So what they're all doing is that they're trying to give you a very clear map of the body or what is going on, and all this works together. All right, and this is like important because can you hold this for me and then pass it back to me? Right, you just receive a very heavy weight, and in that millisecond you can just calculate and know your body position and all this, just to hold that enough energy, right, to hold that position and not fall off due to the weight, and then release and same thing. So your body is doing 1001 calculation every millisecond just to get you posturally, in position. And same thing, your whole trigeminal nucleus is working with your trigeminal nerve and working to get your head in the right position while you're eating, chewing, and everything else, and they work together so that your head will not be flopping down and then you falling off. But if you don't have enough teeth, right, you have a problem, right? You cannot exert that particular control it to the final detail, and then that affects your postural chain. That's why class 2 individual has very forward head posture, right? Not only that they have to try to balance the bike, but they also have an issue with breathing. So the airway also affects. Why? Because for class 2 deep bike, the tongue is in a very enclosed small space. They can't breathe that well. If they stay upright, the jaw gets brought back, and then the tongue blocks the airway. So in order to get that, they stick the tongue out, right? In order to get more air, they need to open up the airway this way. So they have open air, the forward head posture. If the forward head posture, the cervical spine, C5, C6, C7 area will have compression because of the stacking of the spine. Alright, then they have neck issues that develop over time. Not only that, if the bite is not even, they have a high and low positioning. If they bite in and if the jaw is deviated to the side, right, you can see the jaw will go this way, the head will go this way, right, a little, and the whole spine will turn together with it. If you see deviated to the left, you can see the person's right side will be more forward. His hand is one forward, the other. You can see that. Right, the whole body now will have that whole dimensional change, and scoliosis is created. Idiopathic scoliosis created. And if you really investigate, yes, many studies. Alright. So in a way, if you look at things, our head, right, is well aligned, everything is all connected. It's going to pull all these muscles differently. And for 14-pounder bowling ball going off the axis is going to pull on this kind of muscle first, lateral muscle and straight muscle of the neck. And then this is going to cause your first vertebrae atlas to change. And that's we have spinal stenosis. Right, we're going to compact on one small nerve, you feel altered sensation. Think about you crimping the biggest wire in your body. Right, we don't know what is not going down, and we don't know what is not being fed back as well. Alright, and then the postural chain will now be affected because there will be, instead of decompression, we have compression developing. Alright, and pain will start to feature heavily in some individual. Kinetic chain means that every single one of us can exert a certain action and movement because one joint stabilize, the other starts to move, and we pass on that whole cascade from one to the other in order to move smoothly. If one is out of sync, right, we have to exert more power or pressure or energy, alright, and sometimes it creates pain because of that. So the whole joint has to function, in a proper neuromuscular way in order everything to function well. And your jaw joint has totally everything to do with your cervical joint, or cervical joint, everything else to do with your toe joint all the way down. Okay? Because everything is compensating if one is not working well. So once we have cervical alignment, misalignment should I say, don't expect your whole spine to be straight anymore. And then we have all this pain that comes about, and then we go see chiropractor, pain management, orthopedic and all this, when we could have control it at this level because it's the start of the postural chain and it's where the head is. Alright, and if you look at orthopedic, they don't even draw it in. They only start with the first atlas all the way to the coccyx bone. No hands, no head, no legs. So you mean the rest are not in influence, but they don't want to take responsibility for it. As dentists, it's the same thing. When we come to airway even, for example, talking about a class 2 situation, right? A class 2 always have blocked nose because they are a mouth breather. When you're mouth breathing, you're not using your nose. You don't clear your mucus in your nose. Clear it on a regular basis, breathing through your nose. And then have congestion. The mucus in our nose help us to filter the air, lubricate, warm, right? Humidify. Before you get in there, the sinus lining produce nitrous oxide to actually get that vessel dilation that happens in the lungs to have proper oxygen exchange. It only happens here in the sinus if you breathe through it. If you use the mouth, your air is dry, unfiltered, right to the throat, irritates the throat, sore throat, adenoids are increased, right? And then they have all this congestion going on, and they keep seeing the ENT for decongestant, antihistamine, steroids, nasal wash. but it's never never an end to it, because they never clear the mucus. If they change from a mouth breather to a nose breather, we can now slowly clear that out, and then as they establish nose breathing, it gets better. No more of that infection, or else postnasal drip, middle ear infection, rhinitis, sinusitis, all this is common. So as dentists, we can train them using myofunctional activity, right? Close the lip, up the tongue, all right? Swallow properly, breathe through correctly, and then we alter the way they breathe. And we can alter the shape of the jaw. We alter the face. We alter everything else. The ENT do not do hard tissue surgery mainly in the mouth, right? But the blockage is right down here at the oropharynx. The thing is that there's a proper way to manage it, yes, a conventional way. But as a dentist, we can also recognize this whole space like a car cabin. If there's no space at the back seat, they keep stripping the cushion. But unfortunately, this soft tissue will regrow. And many patients do face relapse, and they'll tell you, yeah, back to square one, I need to use a CPAP now, or else I'm still back at, I can't breathe. I stall and I have sleep apnea. But as a dentist, if we know where is the forward position of the jaw within a certain zone, we can move the jaw there, hold it up, right? Then now we have the front car seat going forward and we have more space for the back. Then we can actually influence a person's ability to breathe at night. Because when he fall asleep, the whole jaw doesn't fall back as much. There's vertical stop, and then we create an environment where he can breathe again at night, where he's not depriving his brain from oxygen, right? And we can do that as a dentist easily. The truth is, if we know enough. That's why the Academy of Craniofacial Pain also have a special paper out that recommend dentists go into sleep medicine, be trained in TMD and TMD into sleep, because there's a lot of in-between things, and patient is put into extreme positions sometimes to open our airway. So if you know best, both will be good. So, for example, just now back to that question of the girl doing the. So by identifying her position, all right, we are now able to find that opening and closure path that she's in now. You can see she's opening and closing without deviation and without pain. She opens, she deviates. Then once we establish the position, when she open and close now, the starting point, end point is now established.
So you're really a holistic doctor. I mean, you're doing sleep medicine, neuromuscular dentistry, orthodontics, laser, implants, cosmetics, aesthetics. You're
Functional dentistry, call it.
Integrative
Dentistry. Yeah. Well, like I said, I think we function for Weng Cheu has always been, before aesthetics. I mean, aesthetics is a by the way outcome, but it always ends up really nice and enhancing of the features. But when the whole approach has always been function first, and the way we see the future of dentistry is that healthcare professionals should work more closely and treat the whole person in a more integrative fashion. So we always say that we are starting a healthcare revolution here. We want all the specialists and all the experts to come together, because the human being is a systemic whole. We don't walk around in parts, but our current medical world has really apportioned different parts to different specialists to take care of, and the problem with that approach is that, I mean, just like how we've got patients, right? They have pain in the ear, and they end up seeing the ENT, which couldn't resolve the pain. When actually the root cause of the pain might not be in the ear, right? In this case, it could have been, because of an impingement on the joint, which could have been due to the bite. So, but people don't realize that, a well-trained dentist in the neuromuscular field could have treated that problem. So in the end, a lot of times we see patients who have seen the neurologist, the ENT, the chiropractors, they've seen the whole long list. They come with a whole long list of they've seen 31 over different practitioners. And either by word of mouth, they end up in our office, or sometimes it's just that they just came in for a regular, cleaning, and we spot it, and we pick up on the problem.
And the truth is, dealing with this kind of problem is not easy. It's not easy because you have to be well versed in many areas, right, in order to be able to spot a problem that you think you can actually manage. All right. So it took us years as well to figure out exactly can we spot that point, right? And come to a certain point now that we realize that okay, we have the confidence to treat some. But again, once we know more, we are also now another rabbit hole, right? We know that we don't know enough. All right. That's why we recognize that it cannot be done in just by our own effort. It has to be a collaborative effort. That's why I feel that I'm speaking around the region. The reason is because I want to spread the ideas. As much what I learned from Dr. Clayton Chan, I think what a lot of dentists would like to know about this, especially the younger ones, before they get too deep into traditional stuff. I would say just look forward to a newer possibilities, and then when they can find that vision, and they are on board with us, they are going to be the new type of researchers, right, and clinicians that help us to develop the idea further. All right, and then we're going to be even better and better in managing these kind of cases collaboratively. As dentists, we can do it, but also we need the help of the ENT, the chiropractor, the orthopedics, the neurologists, the sleep scientists, whatever. Everyone should come together. But the fact is that we don't have them under one roof now, and we don't have them maybe thinking about the same thing also, right? That's the hardest part. But I think it's one day we will achieve it, right? That patient do not have to go to different parts or different level of the hospital in order to get answered.
So you went to Las Vegas, Nevada to learn neuromuscular dentistry. You went to Frankfurt, Germany to learn implantology.
Yes.
Where did you learn ortho?
In Singapore, under Kenneth Liu, I went to Hong Kong. Hong Kong. Yeah.
And what program was that?
Invisalign Masterclass.
Invisalign Masterclass.
Under Dr. Yao Yikong, also a fantastic dentist doing Invisalign.
Will you write his name down?
Yeah, of course. Yeah, and of course Clayton also have a module, 3 modules on ortho as well, supporting that.
So now you're actually an Invisalign instructor too, correct?
No, I'm not.
Or an Invisalign
provider.
Because you went to the Invisalign. Okay, when someone takes impressions for Invisalign, the impressions go to Mexico.
Yes.
And they're poured up in the Model Works Mexico. Then it goes to Costa Rica.
Yes.
And you were invited to go to Costa Rica.
Yes.
And why were you invited to go?
I'm one of the earliest provider of Invisalign in Singapore.
Well, tell that story. Tell that story.
Of course. Okay, it has something to do with Dental Town. All right, so basically...
you got to get the Dental Town story.
Yes. I will. I read this advertisement at the back of the magazine, and it was talking about accreditation costs for Invisalign. And it happened to be provided in Hong Kong at that time. All right, so I give a call to make a booking, and the Asia Pacific director, Mark, was there in Hong Kong, and he managed to say that he said if I can manage to get a group of dentists, right, organized for Singapore, he will start a first accreditation course for us in Singapore, right? So I gather, talked to Jerry, talked to Ronnie. I was their associate then, so we got a big group together, and then that's when we had that first training done. Ever since we've been doing.
That was 2006.
Yeah, 5 and 6 around that time. Yeah, 2006 I think.
2006.
And since then we've been doing Invisalign, but of course at the time it was still not that well known and not so well publicized in this part of the world. And over time, we continue to work hard on it, and we have become Platinum Elite provider over the last few years. And with that, I think will give us an opportunity to visit the main center where all the action is, right? So
and that was in Costa Rica.
In Costa Rica.
So what was that like?
Wow, it's a beautiful country, right? And a lot of coffee, And we went to the HQ, right? They're situated in this very nice commercial area for industries and technological companies, tax-free, right? So it's a very, very big center with many rows of computers, and the technicians are assigned to a certain region in order to help us to create our clean check. But I do see some changes that they are doing now is that they are, instead of having cubicles, they're having more center, small little areas where many more technicians and clinicians are working together more collaboratively, looking at many other cases together in order to get the cases, I think, out faster and also more accurately, probably. And then we talked to the design team and also the computer team, development team. Dr. Ramos, right, also was there to hear us why we incorporate. Like for example, like this case. See, after I've taken her bite, for example, you can see from the joint X-ray now that her left side is very curved, right? It's bent because of over compression on the left side every time when she close in. So we decided to use Invisalign after we established the bite position after almost 9 months of myofunctional and conditioning. So this is the starting of Invisalign, and then we use Invisalign instead of a lot of transverse movement. Instead, we have a lot more verticalization movement. All right, and then we're getting the bite exactly to where we want to be. And with this kind of treatment, you can see over time, given enough space and the function is right, the joint has straightened up over the last 16 months of treatment. So even the right side, you can see it actually has improved too, right? So in this way, right, you incorporating neuromuscular, determining where the bite is, then using Invisalign to gear the bite towards it, right? We are able to actually effect a very interesting outcome for the patient. That means we know the destination first for orthodontics now. And orthodontics is incorporative of joint and bite, right? And this is also thinking about the whole person as a whole in terms of postural chain, because it's important. And let me just share another point. Like this case, same thing. She has a deviated bite, midline is off. Neuromuscular allow us to actually establish the midline, okay? And then we send this to Invisalign. So Invisalign will receive a model with open bite. All right, that's where my technician and Jason Ramos was briefed by me personally exactly what we are doing with this kind of submission. Or else, most cases will be submitted like this with a bite already, right? Then we adjust accordingly. So with this, the whole point is now we know where the end is. Now we're just clearing all the interferences of the bite. Then finally, the teeth are able, or should I say the upper and lower arch can now finally close and close up into position.
On your website,
Yep.
it's DP Dental. What does DP mean? Dental practice? What does it mean?
Wow, okay. Again, the origin of this practice, right, started... Louisa was just highlighting me. I want to put credit to Dr. Eugene Chan as well, my senior, right, who also helped me a lot in the early phase of understanding this system. Then 2004, this is where we started the first practice. Okay, again, right, very interestingly, I think, like you, I think everything, we start with a vision, we start with a dream, right? With that, then things will happen. So my dream was that in dental school and the final year practice, we have to do a business plan. That business plan, you tell the whole class, what you're going to do in the future. So together with a few colleagues, I wrote in a plan that I'm going to open a practice in Kovan, this place, in this mall, all right, 4 chair, and doing advanced dentistry. So I wrote that in my treatment plan. I still have that. Business plan, should I say. Yeah, I still have that. I presented to class. That was in 1998. Yep. And when I was working with Jerry, 2004, 2003, should I say, and they have already 3 branches. They want to open the 4th branch. So all I did to Jerry, I was sharing that day, I just told him that this is a good place to think about opening a practice. And he did. So he opened there, one first branch about this place here. Right, so that was the 4th branch of his group called D Pacific. DE Pacific.
DE Pacific?
Yeah, so D Pacific.
Oh, D Pacific. For
Yes.
Dental Pacific? Or?
Yeah, I mean, that's how he called
D
his...
Pacific.
Yeah, his practice then. So that was the beginning, and I worked here, and in 2006 we took over the practice. All right, and then we converted the name to DP Dental, so taking the initial of D Pacific, DP.
You're what's that?
Sorry, I mean, if I may add, I mean, really at that point in time, because Jerry and Ronnie wanted to set up a town practice, and so they wanted to consolidate, but it's also really, in a bid to, let one of their associates actualize, his dream, and that's when they sold their practice to us. And at that point in time also, we got to pick our Mandarin name for our practice, and like that sculpture that you saw outside in the practice, Cheng Xin Yake. I think that really truly epitomizes the type of dentistry that we want to practice. Cheng with, Cheng in Mandarin means honesty, ethical, and Xing means passion, heart, or actually with the 草字头, it means the core, So really, I think our Mandarin name for the practice really epitomizes the spirit of the dentistry that we want to practice. Honest dentistry with a heart, with a passion, with everything being very patient-centered. Yeah.
Now, you two were born in Singapore?
Yes.
But do you also speak Mandarin?
Yes, we do.
So
yeah,
are you
in Singapore, we are, in school, we start off bilingual, so Mandarin was also our first language as well as English.
I only got a couple minutes left with you. You were talking about starting with your vision, and the 7 habits of highly effective people. Stephen Covey talked about starting with the end in mind. I studied economics. I have my MBA in economics, and if you ask anybody with a PhD in economics, what was the fastest built growing economy of all time? It's Singapore. I mean, nothing went from, not to be disrespectful, but even the founder's book was, what was it, from third world to first world?
Mr. Lee Kuan Yew, yes.
Yeah, so a lot of the listeners around the world don't know that Singapore story. Would you mind sharing your thoughts of the Singapore story? Because if you like business like I do, I mean, this is a miracle. Singapore, there's nothing like that ever. So talk about the Singapore story. Or either of you. Both of you.
Okay, so we after post-war, we have been blessed earlier on with, in a way that we grew from a fishing village, right? But we were eyed by the British as a good command post, right, in the center of the Strait of Malacca, because at that time the Dutch has taken over a lot of Indonesia and Malaysia has been establishing themselves here, right? So British decided they need another post, and Singapore was chosen, all right, and that was how we got colonized.
And we have a deep port, so that's to our advantage.
So Singapore was a British colony, or all of Malaysia?
Malaysia also got colonized as well.
So they were British colonies.
Yes, that's right. Yeah.
But Singapore and Malaysia used to be one country, correct?
We were just this. Yeah, I mean, the way they signed the treaty, literally the Malay ruler literally signed this place away to the British as the port. You know what I mean? So it was given out. True enough, I mean, at that time, we have so many islands all around here. It's just nothing big deal that you give away another island.
Right.
It's just an island, nothing there. Yeah, but the British, they developed it well. All right, they develop it into a free port, all right, allowing a lot of trade to go through Singapore, and that is when we really go from strength to strength, all right, as a must-come area, right, when they come to this part of the world to transport goods from east to west, because there's a sheltered pathway, right? Indonesia blocking everything. They just go through straight up Malacca and go into the Indian Ocean, and then through the other way they go to the South China Sea. All right, so Singapore then become better and better through this, and the war came, right? The Japanese came and occupied this whole place for 3 years and 8 months. And the British was expecting the Japanese to attack from the other side. So they have guns facing out to sea, ready to make battle with them. But the Japanese was clever. They took over Malaysia and came down by bicycle. All right, and we lost because they came by the other side. After the 3 years, things was returned to British rule, but a new group of well-educated individual, Lee Kuan Yew and his wife is educated in England, right? So they are very, very good lawyers, and they top their class all the time. The wife topped the class more than Lee Kuan Yew, so she's the better student. And they decided that, look, we have to do something about it. We cannot just let the British rule us forever. We have to do something, and we fight for independence. All right, and through that,
that was Malaysia for independence or Singapore for independence?
Singapore.
And that was 1965?
63 plus, I think, around the 60s, right? So and then we joined Malaysia first. So that was because understanding that if we're going to go out on our own, right? We're just a small island with no resources. We have nothing. We have no gems, no oil, no nothing, right? Just human resources, and we should be incorporated with our hinterland, Malaysia, and then we should grow together. But unfortunately, political reasons, we were being separated out. All right.
So you kicked out the British. You wanted to join Malaysia.
We have made all those arrangements. We went in there for a while, and then we got kicked out. And we were asked to become independent. All right. So then in August, 9th of August, Lee Kuan Yew make a declaration that tell the whole of Singapore through the radio that we are independent. Then from there, I think he has taken on many visionary ideas into how we can continue to grow as a free port that is helpful for us. Yeah. And
I think really, if I may just draw a comparison between the progress of Singapore to like the growth of our practice. Okay, our leaders have always been very forward-looking. Okay, always looking far into the future. That's why right at the beginning, education, we are all to be, bilingual. So if you're Chinese, then you learn English and Mandarin. If you're Malay, English and Malay, but there's that bilingual policy, you see. So, in terms of all the different sectors that we are going into, to help boost the economy, we're always very forward-looking. So, like the latest would probably be into biotechnology, and then setting up the infrastructure to attract the top Nobel Prize winners, to Singapore to develop into that area. I think likewise for us, we at DP Dental, we always have been looking ahead. Weng Cheu has always been just looking ahead, and that's why we adopted the laser 8 years ago. Way before way before it became common. The CAD cam, the CEREC, was also around 7 years ago. So I think in any business, we always have to look very, very far ahead, and also not rest on our laurels, because you always have to keep on, keeping yourself abreast with what is the latest. And that's why we travel all over the world, to learn from other practices around the world, and to constantly keep a pace and know that, hey, we know we are there at the forefront of technology, but we are also applying it in the most conservative way, in a way that's aiding preventive dentistry, And if we really can't prevent, then we do early intervention where we can, and now we're looking into integrative dentistry.
I think the key word is integrative, right? And like, for example, you can see when we incorporate all our thinkings and our equipments, they all work together to create the end product for the patient, right? So just like Singapore, we cannot just depend on one thing. The world moves ahead very quickly, and we just have to just stay ahead of the competition to a certain extent. But to me, we're not really competing, but we're really, I say, we need collaborative. So that's why Singapore has very good relationship with US, and yet at the same time, we have very good relationship with China. Right?
But I'm gonna pin you down to more specifics, because what did Singapore do specifically?
I think it's the government initiative of trying to provide that stability for everybody. All right, stability in the sense that stability in your home, your work, your investment. Right, people can dare to come to say that look, we are governed by rule of law. If you make a contract, the contract stands. If it doesn't, you go and clarify it with the lawyer, with the court. If not, you can go international court and we can still settle things. Right? Everything is by that. So everything is clear, rule of law. Next is that really we value relationship. Right? We are too small to make a biased stand. Right? So like my friend, he's in the diplomatic arena. For Singapore, whenever we are in UN making a vote, all right, we vote by principle. But what's right, we follow that principle and we write it all down, and not because we are taking sides, right? We can't, because when we take sides, this time we win, the next time we are going to be ostracized again by other countries. Then they see that we are just playing politics. We don't. We go by principle, and that continue to hold us up in good stature, so that when we demonstrate that we say we're going to help and we're going to benefit the other country that is helping us, right? We really deliver. So for example, the relationship with US, we're one of the few countries that can go and do war games in Nevada. All right, we can fly the plane, we can bomb the play area. We have the top military aircraft from your country. At the same time, we are able to help China develop their townships. We're able to give and transfer technology, know-how in planning, right, to up their level of living standards and management, right, to be able to run new cities more effectively. We offer our know-how in airport controls to many cities in Asia and beyond. Again, also helping them out to develop the country in this field properly. So we want to do collaborative work. We know, but we don't want to hold it to ourselves, but we share. At the same time, when we share, we're taking care of them, and we know we're being taken care of as well.
And we were taught that one of the things Singapore did most successfully was stamp out all corruption. Would you say that was a big part of the game plan of Singapore's success? Is that they just
because
no
with
corruption?
less corruption, there's more efficiency. Because when you say that if you go and you want to set up a company, you want to get to a certain point, you just need to do this. You pay certain fees, administrative fees, and you get there. And really, by that time, you get a company with a name, and we're ready to go. You don't have to pay anybody else, right? Anyone in the administrative, right? Some extra money to expedite anything, right? They are paid well for doing their own job, right? Even our ministers, you can see there's this YouTube video that our prime minister is the highest paid one. Then you have some other ministers that is lowly paid, right? But they are from very big countries, and there are many. Like for example, it's all out in the open now in Malaysia. You can see that prime minister, he has the ability to take money, and explain himself in such a way that even the whole country has nothing they can do to stop him from doing what is right, or what is wrong, should I say. So yes, I do believe that is really the lack of, or should I say the very low corruption rate in Singapore, right, that allows for public service efficiency, and also that instill a very good mindset in everyone that's doing business with us, to know that we are trustworthy, because there's a rule of law to actually govern everything that we do, right, properly, so that we have the confidence and trust to do business here. And then being able to connect to so many parts of the world, right, we are able to make the difference. For example, if you drop your container here, right, you know there's another container going to your destination in a few minutes time, and you can transfer your cargo accordingly, and you're off to another ship, and you're on your way. So we are able to do that because we aim to achieve it many years ago, with the openness to embrace changes. And like Taman said it, I think we didn't look at this lack of resources as a weakness, but we look at it as a bonus. So what else can you do when you have nothing? just do your best.
Well, you're a legend and a role model all around, and I think you're an amazing man. And behind every amazing man is an amazing woman. I think you guys are Batman and Robin. Congratulations on all your success. I hope you do more with Dentaltown. I hope we do more with you. I hope.
I'm actually in the process of writing a book to share my management experience for the past 10 years. And if I might have the honor, and your word now on camera, that you'd write me the foreword of that book. Thank you.
Consider it done. And then when you're done, we'll blast it out all over Dentaltown and whatever.
Cool.
But
thank you so much.
And I hope someday you build us a course on Dentaltown. I think that'd be a huge honor.
We'll work on it right now.
All righty.
Yeah, man.
All right. Well, thank you for your hospitality.
Well,
It was great seeing you lecture in Medan. It was great seeing your office here. It was great going to dinner. My boys have thoroughly enjoyed your company. You're just great people, and thanks
we'll
again.
continue to connect you with all the top dentists that we know from all around the world. I think they should be on Dentaltown. Yeah.
And if you're ever looking for a vacation, you ever want to see Southeast Asia, my 3 favorite cities in Southeast Asia are Singapore, Hong Kong, and Sydney. Those are just a must 3 that you have to see in your lifetime. You got to see those 3. Those are 3 of the greatest civilizations on Earth. All right. Thank you, buddy.
Thank you, Howard.